Hello, everyone. Welcome to ChillTalk English. I'm Henry, and I'm so happy to see you today.
And I'm Emma. Welcome to all our English learners around the world. We're so glad you're here with us.
Today is a very special day. We're going to learn something very useful, something that can help you when you're not feeling well.
That's right. We're going to learn how to talk to your doctor in English. This is so important for everyone living or traveling in an English-speaking country.
When you're sick, you need to explain how you feel, but sometimes the right words are hard to find. Don't worry, we're here to help you.
We'll teach you simple phrases to describe your symptoms and pain. These phrases are easy to remember and very useful.
So, let's get started. First, let's talk about why this is so important. Emma, can you share a story with us?
Of course. A few years ago, my friend Maria moved to London. She didn't speak much English. One day, she had a very bad headache and fever.
Oh no, what did she do?
She went to the doctor, but she couldn't explain how she felt. She just said, "I feel bad." The doctor asked many questions, but Maria didn't understand. It was very difficult for her.
That sounds so stressful. When you're sick, you need help fast. Language shouldn't be a problem.
Exactly. That's why we're here today. We want to help you feel confident when you visit a doctor in an English-speaking country.
So, let's imagine you're not feeling well. What do you do first?
Well, first, you need to make an appointment. Let's learn some simple phrases for that.
Good idea. Here are some phrases you can use when you call the doctor's office.
First, you can say, "Hello, I would like to make an appointment." This is a polite way to start.
Hello, I would like to make an appointment. Let's all say that together. Ready?
Hello, I would like to make an appointment.
Great! Now, what if you need to see the doctor soon? You can say, I'm not feeling well. Can I see the doctor today?
I'm not feeling well. Can I see the doctor today? Let's repeat that.
I'm not feeling well. Can I see the doctor today?
Perfect. Sometimes the receptionist will ask you about your problem. They might say, "What seems to be the problem?"
What seems to be the problem? Now you can answer with something simple like, I have a headache, or I have a fever.
Let's practice these phrases. Henry, you be the receptionist and I'll be the patient.
Okay. Hello, doctor's office. How can I help you?
Hello, I would like to make an appointment.
Of course. What seems to be the problem?
I have a bad headache.
I see. We have an opening at 3 p.m. today. Is that okay?
Yes, that's perfect. Thank you.
You're welcome. See you at 3 p.m.
Great job, Henry. That was a perfect example. Now, let's move on to what happens when you're actually at the doctor's office.
The doctor will usually start by asking, How can I help you today? Or, What brings you here today?
These are very common questions. You can answer by saying, "I haven't been feeling well," or "I have some health problems."
I haven't been feeling well. Let's all say that together.
I haven't been feeling well.
Good. Now let's say, I have some health problems.
I have some health problems.
Excellent. Now, the most important part, describing your symptoms. This is where many English learners feel nervous.
Don't worry, we'll make it very simple. Let's start with common symptoms like pain, fever, and feeling tired.
When you have pain somewhere in your body, you can say, I have a pain in my, and then say the body part. For example, I have a pain in my head.
That's right. Or you can say, "My head hurts." This is even simpler.
Let's practice with different body parts. Emma, let's do a quick practice session. I'll say a body part, and you make a sentence.
Sounds fun. I'm ready.
Stomach.
I have a pain in my stomach, or my stomach hurts.
Great. Now let's try back.
I have a pain in my back, or my back hurts.
Excellent. Now, throat.
I have a pain in my throat, or my throat hurts.
Perfect. You're doing so well. Now, what about fever? How do we talk about fever?
You can say, "I think I have a fever," or "I have a high temperature."
I think I have a fever. Let's all repeat that.
I think I have a fever.
Good. Now, I have a high temperature.
I have a high temperature.
Great. Now, what if you feel tired or weak?
You can say, I feel very tired, or I feel weak.
I feel very tired. Let's say that together.
I feel very tired.
Good. Now, I feel weak.
I feel weak.
Excellent. These phrases are so useful when you're talking to your doctor.
Now, let's talk about different types of pain. Sometimes pain is not just pain. It can be sharp, dull, burning, or throbbing.
That's a great point, Emma. Let's learn some words to describe different types of pain.
For sharp, sudden pain, you can say, I have a sharp pain in my chest.
I have a sharp pain in my chest. Let's repeat that.
I have a sharp pain in my chest.
Good. For pain that is not strong but continuous, you can say, I have a dull ache in my back.
I have a dull ache in my back. Let's say that together.
I have a dull ache in my back. Great. For burning pain, like when you have heartburn, you can say, I have a burning pain in my chest.
I have a burning pain in my chest. Let's repeat that.
I have a burning pain in my chest.
Perfect. And for pain that comes and goes in waves, like a headache, you can say, I have a throbbing pain in my head.
I have a throbbing pain in my head. Let's all say that.
I have a throbbing pain in my head.
Excellent. These phrases will help you describe your pain more clearly to the doctor.
Now, let's talk about some other common symptoms. What about coughing or sneezing?
For coughing, you can say, I have a cough, or I've been coughing a lot.
I have a cough. Let's repeat that.
I have a cough.
Good. Now, I've been coughing a lot.
I've been coughing a lot.
Great. For sneezing, you can say, I can't stop sneezing, or I've been sneezing all day.
I can't stop sneezing. Let's say that together.
I can't stop sneezing.
Good. Now, I've been sneezing all day.
I've been sneezing all day.
Perfect. Now, what about problems with your stomach, like feeling sick or having diarrhea?
For feeling sick, you can say, I feel sick, or I feel nauseous.
I feel sick. Let's repeat that.
I feel sick.
Good. Now, I feel nauseous.
I feel nauseous.
Great. For diarrhea, you can say, I have diarrhea, or I have an upset stomach.
I have diarrhea. Let's say that together.
I have diarrhea.
Good. Now, I have an upset stomach.
I have an upset stomach.
Excellent. These phrases are very direct and clear. Doctors will understand exactly what you mean.
Now, let's talk about some questions the doctor might ask you. It's good to be prepared for these questions.
That's a great idea. One common question is, when did the symptoms start?
When did the symptoms start? You can answer like this. They started yesterday, or it started 2 days ago.
Let's practice. Henry, you ask me the question and I'll answer.
Okay. When did the symptoms start?
They started yesterday morning.
Good. Another question the doctor might ask is, how long have you been feeling this way?
How long have you been feeling this way? You can answer, for about 2 days, or since last night.
Let's practice again. Emma, you ask me this time.
Sure. How long have you been feeling this way?
For about 3 days.
Great answer. The doctor might also ask, is the pain constant or does it come and go?
Is the pain constant or does it come and go? You can answer, it's constant or it comes and goes.
Let's practice. Henry, you ask me.
Is the pain constant or does it come and go?
It comes and goes. It's worse in the morning.
Good. Another useful phrase, it's worse in the morning. This tells the doctor more about your symptoms.
The doctor might also ask, on a scale of 1 to 10, how would you rate your pain? This is a very common question.
On a scale of 1 to 10, how would you rate your pain? You can answer with a number. For example, it's about a 7, or maybe a 5 or 6.
Let's practice. Henry, you ask me.
On a scale of 1 to 10, how would you rate your pain?
It's about a 6. It's not too bad, but it's uncomfortable.
Great answer. Adding more details helps the doctor understand better.
Now, let's talk about some vocabulary. We'll spotlight 5 useful words for talking to your doctor.
Great idea. What's our first word, Emma?
Our first word is symptom. A symptom is a physical or mental feature that indicates a condition of disease. For example, my main symptom is a headache.
Symptom. Let's all say that.
Symptom.
Good. Now let's use it in a sentence. I have many symptoms.
I have many symptoms.
Great. What's our second word?
Our second word is prescription. A prescription is a doctor's written instruction for the preparation and use of a medicine. For example, the doctor gave me a prescription for pain medicine.
Prescription. Let's say that together.
Prescription.
Good. Now let's use it in a sentence. I need to fill my prescription at the pharmacy.
I need to fill my prescription at the pharmacy.
Excellent. What's our third word?
Our third word is diagnosis. A diagnosis is the identification of the nature of an illness or other problem. For example, the doctor's diagnosis was a common cold.
Diagnosis. Let's all say that.
Diagnosis.
Good. Now let's use it in a sentence. I'm waiting for the doctor's diagnosis.
I'm waiting for the doctor's diagnosis.
Great. What's our fourth word?
Our fourth word is treatment. Treatment is medical care given to a patient for an illness or injury. For example, the treatment for my flu was rest and lots of water.
Treatment. Let's say that together. Good. Now let's use it in a sentence. What treatment do you recommend?
What treatment do you recommend?
Excellent. What's our fifth and final word?
Our fifth word is appointment. An appointment is a formal arrangement to meet or visit someone. For example, I have an appointment with my doctor at 3 p.m.
Appointment. Let's all say that.
Appointment.
Good. Now let's use it in a sentence. I need to make an appointment.
I need to make an appointment.
Perfect. These 5 words will be very useful when you talk to your doctor in English.
Now, let's do a mini practice session. We'll create a short dialogue between a patient and a doctor. Henry, you can be the doctor, and I'll be the patient.
Great. I'm ready. Come in, please. Have a seat. So, what seems to be the problem?
Thank you, doctor. I haven't been feeling well for 2 days.
I see. What are your symptoms?
I have a bad headache and a sore throat. I also feel very tired.
When did the symptoms start?
They started 2 days ago.
On a scale of 1 to 10, how would you rate your headache?
It's about a 7. It's quite painful.
I see. Have you been taking any medicine?
No, I haven't. I thought I should see a doctor first.
That's good. Let me take a look at your throat. It looks red. I think you have a throat infection.
What treatment do you recommend?
I'll give you a prescription for antibiotics. You should also rest and drink lots of water.
Thank you, doctor. When should I feel better?
In about 3 to 4 days. If you don't feel better by then, please come back.
Thank you so much.
You're welcome. Take care.
Great job, Henry. That was a perfect example of a doctor-patient conversation.
Thank you, Emma. Now, let's talk about some phrases you can use at a pharmacy. After you see the doctor, you might need to get medicine.
That's right. At the pharmacy, you can say, I have a prescription, or I need to fill this prescription.
I have a prescription. Let's repeat that.
I have a prescription.
Good. Now, I need to fill this prescription.
I need to fill this prescription.
Great. The pharmacist might ask, have you taken this medicine before?
Have you taken this medicine before? You can answer, no, this is my first time, or yes, I've taken it before.
Let's practice. Emma, you be the pharmacist, and I'll be the customer.
Okay. Hello, how can I help you today?
Hello. I have a prescription from my doctor.
Great. Let me see. Have you taken this medicine before?
No, this is my first time. How should I take it?
You should take one pill twice a day with food. Make sure to finish all the medicine even if you feel better.
Thank you. Are there any side effects?
You might feel a little sleepy. Don't drive after taking this medicine.
Good to know. Thank you for your help.
You're welcome. Take care.
Perfect. Now we know what to say at the doctor's office and at the pharmacy.
That's right. But remember, if you have a medical emergency, you should go to the emergency room or call for an ambulance.
That's very important. In an emergency, you can say, I need help immediately, or this is an emergency.
I need help immediately. Let's repeat that.
I need help immediately.
Good. Now, this is an emergency.
This is an emergency.
Great. If you're calling for an ambulance, you can say, I need an ambulance, please.
I need an ambulance, please. Let's say that together.
I need an ambulance, please.
Excellent. I hope you never need to use these emergency phrases, but it's good to know them.
Absolutely. Now, let's talk about some general tips for communicating with your doctor in English.
Great idea. What's your first tip, Emma?
My first tip is to speak slowly and clearly. Don't worry about making mistakes. The doctor's job is to understand you and help you feel better.
That's so true. Doctors are used to talking with people from different countries. They are patient and helpful.
My second tip is to prepare before your appointment. Write down your symptoms and questions. This will help you remember what to say.
That's excellent advice. You can even practice what you want to say at home. Practice makes perfect.
My third tip is to bring someone with you if you're nervous. A friend or family member can help you communicate with the doctor.
That's a great suggestion. Having support can make you feel more confident.
My fourth tip is to ask the doctor to speak slowly if you don't understand. You can say, could you speak slowly, please? Or, could you repeat that?
Could you speak slowly, please? Let's repeat that.
Could you speak slowly, please?
Good. Now, could you repeat that?
Could you repeat that?
Excellent. Doctors will be happy to help you understand.
My fifth and final tip is to bring a dictionary or use a translation app on your phone. This can help you understand medical terms.
Those are fantastic tips, Emma. Thank you for sharing them.
You're welcome, Henry. Now, let's do one more practice session. This time, we'll focus on different health problems.
Great idea. Let's start with a common problem, allergies. How would you talk about allergies to a doctor?
You can say, I think I have allergies, or I'm allergic to.
I think I have allergies. Let's repeat that.
I think I have allergies.
Good. Now, I'm allergic to.
I'm allergic to.
Great. You can finish that sentence with what you're allergic to. For example, I'm allergic to dust, or I'm allergic to cats.
Let's practice. Henry, you be the doctor, and I'll be the patient with allergies.
Okay, come in. What seems to be the problem today?
Hello, doctor. I think I have allergies.
I see. What are your symptoms?
My eyes are itchy and watery. I also keep sneezing.
When do you notice these symptoms the most?
Usually in the morning when I wake up.
Do you have any pets at home?
Yes, I have a cat. I think I might be allergic to it.
That's possible. I can recommend an allergy test to confirm. In the meantime, you can try taking antihistamines.
Thank you, doctor. I'll try that.
You're welcome. Let me know if the symptoms don't improve.
Thank you. Goodbye.
Goodbye. Take care.
Great job, Henry. Now, let's talk about another common problem, a cold or flu.
Good idea. For a cold or flu, you can say, I think I have a cold, or I might have the flu.
I think I have a cold. Let's repeat that.
I think I have a cold.
Good. Now, I might have the flu.
I might have the flu.
Great. You can also describe your symptoms like this. I have a runny nose, or I have a cough and fever.
I have a runny nose. Let's say that together.
I have a runny nose.
Good. Now, I have a cough and fever.
I have a cough and fever.
Excellent. Let's practice with a short dialogue. Emma, you be the doctor this time, and I'll be the patient with a cold.
Okay. Hello, Henry. Please have a seat. What brings you here today?
Hello, Emma. I think I have a cold.
I'm sorry to hear that. What are your symptoms?
I have a runny nose and a sore throat. I also feel very tired.
Have you taken your temperature?
Yes, I have a low fever.
When did these symptoms start?
About 3 days ago.
I see. It sounds like a common cold. Make sure to rest and drink lots of fluids. You can also take over-the-counter medicine for your symptoms.
Thank you, doctor. How long do you think it will last?
Usually about a week. If you don't feel better in a few days, please come back.
Okay, I will. Thank you.
You're welcome. Take care of yourself.
Thank you. Goodbye.
Goodbye.
Great dialogue, Emma. Now, let's talk about one more common problem, stomach issues.
Good idea. For stomach problems, you can say, I have stomach pain, or I feel nauseous.
I have stomach pain. Let's repeat that.
I have stomach pain.
Good. Now, I feel nauseous.
I feel nauseous.
Great. You can also say, I have diarrhea, or I've been vomiting.
I have diarrhea. Let's say that together.
I have diarrhea.
Good. Now, I've been vomiting.
I've been vomiting.
Excellent. Let's practice with one more dialogue. Henry, you be the doctor again, and I'll be the patient with stomach problems.
Okay. Come in, Emma. Please sit down. What's been bothering you?
Hello, doctor. I have stomach pain.
I'm sorry to hear that. Can you tell me more about the pain?
It's a sharp pain in my lower stomach. I also feel nauseous.
When did the pain start?
Yesterday morning.
Have you eaten anything unusual recently?
Now that you mention it, I ate at a new restaurant yesterday.
I see. Have you had any other symptoms?
Yes, I've had diarrhea since last night.
It sounds like you might have food poisoning. Make sure to drink lots of water to stay hydrated. I can prescribe some medicine to help with your symptoms.
Thank you, doctor. When should I feel better?
In a day or two. If the symptoms get worse, please come back or go to the emergency room.
Okay, I will. Thank you for your help.
You're welcome. Take care.
Thank you. Goodbye.
Goodbye.
Great job, Henry. We've covered so many useful phrases today for talking to a doctor in English.
We sure have. From making an appointment, to describing symptoms, to getting medicine at the pharmacy.
I hope our listeners feel more confident now about talking to doctors in English. Remember, it's okay to make mistakes. What's important is that you communicate how you feel.
That's right. Your health is important, and doctors are there to help you, no matter what your English level is.
Before we finish, let's do a quick review of the most important phrases we learned today.
Great idea. Let's start with making an appointment. You can say, hello, I would like to make an appointment.
Hello, I would like to make an appointment.
Good. For describing pain, you can say, I have a pain in my, or my hurts.
I have a pain in my, or my hurts.
Excellent. For describing symptoms, you can say, I have a fever, or I feel nauseous.
I have a fever, or I feel nauseous.
Great. For answering the doctor's questions, you can say, they started yesterday, or it's about a 6 on a scale of 1 to 10.
They started yesterday, or it's about a 6 on a scale of 1 to 10.
Perfect. And at the pharmacy, you can say, I have a prescription, or I need to fill this prescription.
I have a prescription, or I need to fill this prescription.
Excellent. These phrases will help you communicate with doctors and pharmacists in English.
Remember, practice makes perfect. Try to practice these phrases at home so you feel more confident when you need to use them.
That's right. And don't forget to bring a small notebook to write down what the doctor says. It's hard to remember everything when you're not feeling well.
Great tip, Henry. Also, remember that it's okay to ask the doctor to speak slowly or repeat something. You can say, could you speak slowly, please? Or, could you repeat that?
Could you speak slowly, please? Or, could you repeat that?
Perfect. Now, let's talk about how to make a follow-up appointment.
Good idea. After your visit, the doctor might say, come back in a week, or make a follow-up appointment for next month.
Come back in a week, or make a follow-up appointment for next month.
If you need to make a follow-up appointment, you can say at the reception, I need to make a follow-up appointment.
I need to make a follow-up appointment.
Great. The receptionist might ask, what day works for you? Or, do you prefer morning or afternoon?
What day works for you? Or do you prefer morning or afternoon?
You can answer, any day next week is fine, or morning is better for me.
Any day next week is fine, or morning is better for me.
Excellent. Now you know how to make both regular appointments and follow-up appointments.
We've covered so much today. I hope our listeners feel more prepared to talk to doctors in English.
I do too. Remember, your health is important, and these phrases will help you get the care you need.
Before we finish, let's do one last motivational message for our listeners.
Great idea. Learning English can be challenging, especially when it comes to important situations like talking to a doctor.
But remember, every phrase you learn makes you more confident. Every practice session helps you improve.
Don't worry about making mistakes. Mistakes are part of learning. What's important is that you try.
That's right. Doctors are kind and understanding. They want to help you, not judge your English.
So be brave. Speak up. Ask questions. Your health is worth it.
And remember, we're here to help you every step of the way. We believe in you.
We sure do. You're doing great, and you'll get better and better every day.
That's right. Now, let's say goodbye to our wonderful listeners.
Thank you so much for joining us today on ChillTalk English.
We hope you found this lesson helpful and feel more confident about talking to doctors in English.
Remember to practice these phrases at home. The more you practice, the more confident you'll feel.
If you have any questions or want to share your experiences, please leave us a comment. We love hearing from you.
That's right. Your comments help us make better lessons for you.
Don't forget to subscribe to our channel so you don't miss our future episodes.
And share our videos with your friends who are learning English too.
We'll be back next week with another fun and useful lesson.
Until then, take care of yourselves and practice your English every day.
Bye for now, everyone. Stay healthy and happy.
Goodbye. We love you all.
Goodbye.